The FDA has approved the first gene therapies to treat patients with sickle cell anemia.
And the new therapy changed the life of a 15-year-old boy. From the time he was a baby, pain was at the center of Johnny Lubin's daily existence.
Like my lower back, and it'd really be hurting.
Johnny had inherited a sickle cell gene from each of his parents, Fabienne and JR.
It was devastating as I found out and discovered more about the disease.
Pain from sickle cell can occur anywhere blood circulates. That's because red blood cells, normally donut-shaped, bend into inflexible sickle shapes, causing them to pile up inside blood vessels and prevent the normal delivery of oxygen throughout the body. Complications include bone deterioration, strokes, and organ failure. For more than a decade, Johnny was in and out of the hospital.
We felt like he suffered for so long and so much that we wanted to try, anything.
In the past, that would have meant correcting those abnormal red blood cells using donated bone marrow. As an only child, Johnny had only about a 15% chance of finding a match. But then the family learned about a cutting-edge clinical trial to edit a small number of the billions of letters in Johnny's genetic code and relieve his symptoms. No donor would be needed.
They did explain that it's a trial.
First, stem cells were removed from Johnny's bone marrow and he was given chemotherapy to help wipe out the abnormal cells. Then, in a laboratory, the gene editing technology called CRISPR was used to increase the amount of a protective form of hemoglobin, a protein that picks up oxygen from our lungs and delivers it throughout the body. The cells were then infused back into Johnny's bloodstream. Dr. Monica Bhatia is chief of pediatric stem cell transplantation at New York Presbyterian Columbia and Johnny's doctor.
You're reprogramming your cells to produce fetal hemoglobin. And it's been widely known that those who have higher levels of fetal hemoglobin tend to have less severe symptoms of sickle cell disease.
As an investigator in the CRISPR trials, Dr. Bhatia was well aware that there was no margin for error.
You're changing somebody's DNA, so obviously you want to make sure that the corrections you're making are the ones you want.
October 4th was infusion day. We like to call that my second birthday.
After 5 weeks in the hospital and 6 months out of school, Johnny was living a whole new life.
I thought that was pretty cool, how I have new cells. And I honestly hoped, I could get, some superpowers from it, like genetically engineered.
His doctor said he's, everything looks good. He can go and live his life as a normal kid.
So glad to see he's doing well.
I think he already has a superpower.
He sure
just
does.
Doesn't know it yet.
And there are some important things to note here, though. Doctors say patients will have to be followed long-term before the experts call this a cure. Gene editing is expected to cost several $million per patient, and it may not be appropriate for everyone with sickle cell. It would also not prevent the gene from being passed down to future generations.
What a game changer it could
Absolutely.
be, for sure.
Yeah.
Great story, Liz. Thanks.